Good. Thank you all very much. Appreciate everybody joining us this morning. My name is Jamie Sparks. I'm with Coordinated School Health at the Department of Education.
And I'm Stephanie Bungie. I'm also with Coordinated School Health at the Kentucky Department of Education.
As we get into this morning, we're going to do a lot of interactive things. We have a couple of interactive polls and different things. So we're going to switch over to the PowerPoint version just so you can write down our contact information as well as some other things that we'll be using over the course of the day. So on the screen there, you'll see my email address as well as Stephanie's email address. If you're using Twitter, your health department is using Twitter, there you'll find our Twitter addresses as well. So at Jamie Sparks CSH and at SBungie CSH. In addition, and we've done this before with ITV, if you have different questions that come up during the day, feel free to speak up at any time. But if you prefer to either use Twitter or even text a question, or you want us to review something or go over it again and you don't feel comfortable speaking up with the camera and the technology, feel free to text that number there, 606-315-3737. So we want to offer you plenty of modems for whatever you're most comfortable with doing. So we'll wait just a second to give everybody a chance to have that written down. As I mentioned Twitter earlier, we've done a lot of trainings in the last year across the state. So there's a lot of information and resources and conversations that have occurred. And we've really been using the social media platform. So the hashtag KYShape and hashtag KYCSH, you will find a lot of different resources that have been posted, pictures from different events. You'll find YouTube videos that have been done around many of the things that we'll be talking and discussing today. So both of those are resources that you can access at any point to find additional information and conversations that have occurred as a result of some of the trainings we've been doing. So as we look at the goal of this new opportunity that's been offered through the maternal child health drop-down, here are three of the major highlights that we're going to focus our day on today and what the role or expectations is around coordinated school health with this MCH funding option. It was outlined in the information in the packages to select a school district with at least 3 schools that you want to focus on. We did note in those instructions that we prefer a couple different levels of schools, but we are more than happy to work with you in whatever works best for your area. Once you select a district and those 3 schools, or a minimum of those 3 schools, it is very important, and one of the tools that we'll be covering today to identify a contact person at the school level. We'll talk about why that is an important factor to make sure you've identified with this relationship moving forward, working with that school to partner and help them with these conversations. And then we will be, over the course of this day, working to identify these evidence-based practices around the WellSat, around the Alliance for Healthier Generations Healthy Schools program, and then we'll also look at the new initiative with Let's Move Active Schools. So those are 3 different options that were listed within the MCH instructions, and so that's the goal of our training today, is to kind of build what's happening at the state level and then how you can bridge that gap with helping local schools around these issues and assessments around improving physical activity and nutrition. Before we go any farther, we'd like to take an opportunity to practice. We do have a couple interactive polls that are inserted throughout this presentation. So here's one, and here I'll walk through this, and this is just a simple one we wanted to practice with. Using texting, you can text, the number you're going to send it to is right here. So we're going to practice this. So the question is, have you been a member of a coordinated school health committee advisory previously? So the to number is 37607. Type that in the to part. Yes, I've been involved. all you simply do, if you, yes, you have been involved in a committee in some aspect before, whether at the school or district level, as a parent or in your official capacity as a health department, if the answer is yes, you do 264682 in the body of the text and hit send. If you've never been involved in any way, shape, or form with a committee, you'll text in the body 676682. So there you see the first person has cast their vote, and so we'll give it just a few minutes to take a poll of the audience, and it's just a way for practice of some of the additional things we'll be doing over the course of the day using this interactive polling. Let's switch back to video for a second.
To us.
Yeah. Great. We still have some results coming in on that, and we'll flip back that in just a second. The other thing that we've done, we've strategically placed these interactive polls within the presentation throughout it. And so we have, one of the things we're going to talk about is wellness policy. And the one thing that we like to say about wellness policy is not what you say, but what you do. So one of the wellness policies we have as a training staff and all the events that we go to is our wellness policy says that we will not sit for longer than 30 minutes at a time. And so anytime we have a poll, we've also built in where we're going to do some sort of stand-up movement exercise. Very simple rule we go by that I like to say, if your bum is numb, your brain is too. So we want to make sure that we're up and moving and active and energized. We believe that's best for students, but we also believe that's the best for adults. So if everybody out there could go ahead and stand up. We see you out there. Yes, we do. We'll start flipping on certain cases. It's not going to be a vigorous exercise. This is easy. We're just stretching right now. We will pull a couple of resources up later in the day and show you some things that you can share with schools when you're working with schools and do some of those things. But this first one's just going to be very simple. Just get us up and just ready for the day to get started here. So let's just start with some just trunk twists. So elbows up and just twisting back and forth. Job, go ahead and stretch to the sky. Kind of lean it to the left. Good job. Thank you. See, that was a very simple one just to get us started and make sure that we're going to practice what we preach today. So as we do those polls, you can always know, we'll show you some examples of actual activities that you can pull and share with schools that are free resources that we know that are out there. So let's build the big picture first before we actually go into some of the expectations. And the one thing we want to make sure that we're clear with, and the reason we wanted to cover parts of this is to show at a state level we have a very strategic plan that we're working on. These are just not random hit and miss programs that we're asking schools to do. We've worked to align these strategically with a number of KDE initiatives. And then we also want to enhance the work you do as a partner for local schools around assisting schools. So currently right now, Kentucky is one of 50 states funded under this new 1305 quad grant, we refer to it as. 32 of those states also received an enhanced component of funding. And so collectively, school health is now funded with this quad grant with diabetes, heart disease and stroke, and obesity prevention. So those 4 areas are what we refer to as the quad grant coming out of CDC now. So we know that all 50 states are working on these measures for school health. Ours are very specific with nutrition and physical activity outcomes. So overall, big picture, what's going on in Kentucky out of the Department for Public Health. We have basic funding and enhanced funding that averages out to $1.7 million over the next 5 years. So we are 1 year into this. This MCH funding that you're receiving is not a part of that. So that is something that the Department for Public Health has done in addition to this funding that we're working with schools, and so how to address those and how to improve those. So this is an exciting opportunity. I know many of you yesterday that are also doing the CSH option are also working with tobacco-free schools. We are still heavily involved with that. We work with Elizabeth Hoagland Anderson on a regular basis. We have a new commissioner letter, support letter from both commissioners getting ready to come out very soon. So even though we don't have direct funding at KDE for tobacco-free, we're still very much engaged in that as well as we are with these specific things we are funded for with nutrition and physical activity. We have a very strong collaboration between both agencies here with the Department of Education and the Department for Public Health. Probably one of the stronger collaborative cross-agency that we have in the U.S. right now. And so we constantly are sharing what we've done with this new grant funding with other states. So it really is something that other people are looking at what Kentucky is doing relative to this cross-agency collaboration. We do have a MOU and MOA that were signed. Dr. White, your associate commissioner here at KDPH, is also the principal investigator for our new quad grant. And then many of you that have worked with Bonita Bobo before, her and I serve as co-lead for the entire quad grant. And then our oversight was given to our health subcommittee. And so that's a strategic thing that we started a few years ago. And I'll share the next slide with what that looks like and why that's so important for the work that you're doing, but also for the advocacy for the work we're doing here at the state level. There's our contact information again of our team that makes up Coordinated School Health. You'll notice that 2 of those people are in red. That's because they haven't started with us yet. We've been a staff of 2 all summer long, but this month we expect on the 16th on the DPH side, Nicole Barber-Culp will start as our Coordinated School Health Administrator. Many of you in the past may have worked with Victoria Greenwell, who's been on our team. She accepted a position with behavioral health back at the beginning of summer, and so that's a position that's been vacant. And then on the KDE side, we're hiring Audra Deely-Hoofnagel, who is a teacher here in Franklin County and is going to come on as an MOA employee for the next 3 years for us, working on our strategic priorities. So we're excited to be back to full staff. It allows us to do more outreach and support the work that you guys are doing with local schools as well. Here's our State Health Subcommittee. A few years ago, we received funding from Robert Wood Johnson Foundation to start a health subcommittee at the state level. And that was really just getting the Kentucky Board of Education involved and engaged in bringing awareness. When we first started that committee a few years ago, it was Dr. Hacker that actually served as the KDPH representative. And then we've since expanded this group. We meet every other month, typically the day before the state board meets. So this group has been really pivotal in many of the things that have happened in our state relative to BMI being added to the physical exam forms, looking at reviewing nutrition, physical activity policies and how to move those forward. There's a recent leadership summit on obesity that University of Kentucky hosted. Many of our members were there. This group right here will be hosting a health subcommittee meeting at Southern Obesity Summit that's coming up in Louisville, October 5th through the 7th. And so it is a collective group of people from diverse backgrounds. So there is a voice in Frankfort with the state board and also working with the next thing we're going to talk about, which is the Kentucky Health Now plan. In February, Governor Beshear signed this into existence. There was an oversight team that was created, and so it is representative of all state agencies. So Lieutenant Aberson, Lieutenant Governor Aberson, and Commissioner Mayfield serve as chair and vice chair for that. And so many of you have heard of this and know that it's growing in awareness and outreach and what's happening. And so we just want to take a few minutes before we go into the specific targeted interventions that we're going to talk about today and share with you some specific school health things that also align with what you guys will be doing and working with local schools in. So these are all measures that we are reporting quarterly to the Kentucky Health Now group. So I'm going to turn that over to Stephanie to share some of that work specifically with Kentucky Health Now.
All right, so you may or may not be familiar with some of the overarching goals for the Kentucky Health Now plan. So at the top, you'll see reduce Kentucky smoking rate by 10%. And underneath that is the school strategy. So looking to get schools and districts to implement tobacco-free campuses, looking at the measurement of school districts that have passed a 100% tobacco-free schools policy. So again, that's a different MCH package possibility for some of you, but knowing that that is also tied to the Kentucky Health Now plan. Currently, I think there's 33, it might be 34, I can't remember now at this point, but that's quite a few school districts, so we're making progress there. Another goal for Kentucky Health Now plan, reduce the obesity rate. So the school strategy is looking at the number of schools that have a coordinated school health committee, seeing that connection right now between the work you'll be doing with schools. The data that you see in front of you is taken from the Practical Living Career Studies program review, and we'll talk about that more in detail later. But knowing that the numbers at the bottom, this is the number of schools at all levels that reported if they were either at no implementation, needs improvement, proficient, or distinguished. So you can see there's a big chunk towards the end, the bottom end of that. So we're hoping that the work you're doing and the work that we're doing through the quad grant will really help increase the number of committees at the school level. Again, connected to the obesity rate, lowering the obesity rate in Kentucky, we're looking for schools to implement comprehensive school physical activity programs, which we acronym as CSPAC. So if you hear us say that, that's what that means. And again, this data will be taken from the Practical Living Career Studies program review, which is the accountability measure for schools, and practical living encompasses health and physical education, and physical activities included in that. And you can see the current numbers. This was for the 2012-2013 school year. We'll be able to update this data. I think it usually comes out the end of September, beginning of October for this past school year. So we'll be able to get some updated numbers soon and hopefully see some improvement with committees and the use of CSPAC. Jamie mentioned partnering with districts to collect BMI data within Kentucky Student Information System, which is currently Infinite Campus. The data should be available soon. It said June 2014, but I don't think the reports have been run yet. So we'll be looking at getting some aggregate data to look at this strategy also. Looking at a sort of a recognition system as it relates to obesity rate for schools that provide more opportunities for physical activity. You'll see that Let's Move Active Schools is listed here. We have the capability to run data to see which schools are involved and are utilizing Let's Move Active Schools. And so when this measure was originally done, 350 schools have enrolled in it. We've been doing a lot of trainings throughout the summer, so hopefully we'll pull those numbers again soon, and hopefully there'll be another increase. But this is also another connection to work that you could possibly do with the district and schools that you choose to work with within the funding. All right, so got data. Are there any questions yet before I move on?
Just kind of
Are you going to have this presentation available for us afterwards with the data?
Yes, it will be archived.
Okay, thank you.
You're welcome.
And there was an email sent this morning, and there's a PDF version of this. So if you did not receive that this morning, just let us know. You can text me now or email me, and I'll make sure you get that now. But you may want to check your email box from this morning. A PDF version of this presentation was sent in. Thank you for bringing that up. I should have mentioned that when we started.
Yeah, I guess I didn't see it in my emails this morning, but I'll run back there and see if I can find it.
we'll get into the data portion, and this is also mentioned on the information that's sent with the funding, the package. So our program, our coordinated school health team at the department, we collect two main data sources. One is the Youth Risk Behavior Survey, YRBS. Most of you probably familiar with it, heard of it, maybe pulled numbers from it. And then also our other data measure that we collect is called School Health Profiles. That is a survey done to a sample of middle and high schools across the state. One survey goes to the principal and one survey goes to the lead health education teacher, looking at what content is taught in the health education classroom, and then also what programs and policies are in place. So what I'm going to do right now is take you through the process of finding that data. It can be a little tricky at times. So if you were to go to the Kentucky Department of Education's main webpage, the easiest and best thing to do, because our website is pretty terrible to navigate, is to go into the search bar. So if you're wanting to look up the YRBS data, the Youth Risk Behavior Survey, all you have to do is type in YRBS, hit search. First item that pops up is the website for the YRBS. This gives a little background information, but most importantly, and what the information you're going to want are all these reports listed here. All the data that we get back from CDC, and there's an abundance of it, is listed here. So we get data for high school level and middle school level. Important to note that this is state level data. This is not school, district, or county level data. There's not a big enough sample of students that participate to be able to drill it down to a smaller level. So we do have state level data. The summary tables gives all the data reports, all the data measures. There's also right here, the 2013 YRBS resource booklet is something that we developed to kind of highlight the main trends and link between health and academic achievement data for 2013. We will be gearing up to do YRBS again in 2015. I'm starting that process now, and that begins in January. Here's the resource. It's very user-friendly, colorful. We have printed copies. If you're interested, just email me, let me know, and I'll mail you some. Or you can just, like I said, just access it from the website. But it breaks it down by the 6 health risk behaviors of youth. So looking at injury and violence, alcohol and drug use, physical activity, dietary behaviors, sexual risk behaviors, tobacco use. I think that's the 6, sorry. But as you can see, these are trends. So these were statistically significant changes from 2011 to 2013. And I'll say that usually we only have 2 to 3 changes, significant changes from one survey year to the other. This past time we had 20, many of them positive, which is great. So I highly recommend looking at those. And then a very important part, especially when working with schools and trying to get administrative buy-in, is this academic achievement part. So the survey asks students also what type of grades they get, mostly A's, B's, C's, or D's, F's. And then CDC runs a report that correlates that with the risk behaviors. So looking, as you can see on this one, at the top, students who've ever used marijuana. Students that get A's, it's only 3.5%. Students with D's and F's is 20.2%. So that's a big jump. So this helps highlight that, yes, it's important to get students healthy, making healthy decisions, and it will help their academic achievement. I've pulled certain ones, obviously, for this resource, but if you go back to the regular website, you'll see 2013 high school academic achievement, 2013 middle school academic achievement, and it gives all the risk behaviors that are asked on the YRBS. So there's an abundance of data here. One more thing just to highlight real quick is a little bit further down is this PowerPoint presentation right here. So taking that health and academic achievement data, turning it into PowerPoint presentation that is available for anyone to use. You can copy and paste. straight from it, just based on what your needs are and who you might be presenting the information to. It just gives a little background about the YRBS, but then it's looking at putting all that data into some graphs that you can use to get a point across, to get some buy-in, create awareness, whatever you may need. So feel free to utilize that resource. It's broken down by high school and middle school, and then again into those 6 health risk behaviors of youth. So it separates it out. You can pick and choose what you may need. There we go. Okay, so that's the YRBS data. And then if you go back up to that search bar and type in profiles. So school health profiles, we shorten it and we just refer to it as profiles. Again, it is the first thing that pops up when you put it in the search bar. It gives you some more information about the what it measures and how the data is used. There is a trend report, principal survey report, and teacher survey report. The teacher one mainly has the content that is taught within the health education classroom, and I'd also asked a lot of questions about professional development that they've received or would like to receive, because this is a huge data source for our funding to help guide our efforts with the professional development that we provide to the teachers. The principal survey deals a lot more with the policy, and then it also includes the physical education and physical activity questions. This data, again, is at a state level, but it is broken down also by middle and high school when you get into it. So I can show you one real quick. In the principal survey, so this question right here, it asks principals, percent of schools that have ever used the school health index or other self-assessment tool. You can see there's a column for the high schools, the middle schools, and then all schools, and it's broken down by health topic. It'll give you, like I said, at the side, the all schools. So this is another data source that you could possibly use within the work that you'll be doing. Are there any questions on the YRBS or school health profiles data? All right. Got another poll for you.
I had a couple of emails I was responding to, people requesting the slides, so Audrey Powell and Bridget Likens, you should be getting those momentarily on that request. This poll is another interactive poll here to get some feedback from you on this data that we just shared. Obviously, there's lots of use, especially when talking about actual student level behaviors or actual school health content, curriculum issues that you've seen in profiles. So the question is, share why Kentucky-specific data can be so beneficial from your work and role and getting buy-in. So the text number this time is 6. You're going to, in your message, this is what you type. You text 677-373. And then at the start of your message, so this goes in the body, 37607, and once you type in that, then you write the reflection. So I'm going to do one as an example right now. So in the to section, I'm typing 677-373. Now, at the first part of the body of my message, I'm using the 37607 code, 37607. And then you hit your space and then type your message, and then you'll see responses start coming in from that. And as while we're doing this, let's go ahead and do a quick, we got 8 minutes before 10 till, so at 9:50. If you want to do a restroom break or stand up and stretch break, we'll start back with a resource, but just gives everybody a chance to respond. And then also, I know many of you just getting started in the morning as well. So stand up, move around, restroom, grab a drink, and then at 9:50 Eastern Standard Time, we will start back. So that's 8 minutes.
Stephanie or Jamie? Okay, I guess I'm just technologically illiterate. Are you there?
Yes, we're here. I don't think it's you, actually. I think it might be Jamie.
Jamie, this is Emily in Mercer County. Anyway, so I'm trying to send my message, so I go to where it says 2 on my phone, and do I type in 677373?
Your message, so the 2 part, I said it backwards. 37607 goes into 2, and then the first part of your body.
Okay, well, that's what I thought that was the number you had last time. 3.
We have a very distinguished group out there that knew not to listen to me, apparently, because they figured it out, and I did it. I said it backwards when I said the description.
Okay, well, that makes me feel a little better. Okay, so.
I told you it wasn't you. It wasn't you. Told you.
Okay, good. I like that when other people.
The teacher tells you wrong, Emily. That was my approach there.
I like it when other people are human.
All right, we're going to start back real quick. Thank you so much for the responses to the poll. They were great. Something else I guess I should mention, especially when someone brought up what's happening in other states and how Kentucky compares. The CDC's website, well, actually you can get to it from our YRBS webpage on the KBE website that I showed you. There's a link there that directs you to the CDC's website, and they have a tool called Youth Online. It takes you there to that page. You would see it. But you can pull up and compare our students to any other state that received weighted data, which was, I think, about 40 some odd different states. So there are other tools on the CDC website as well. So if you're interested in that, but we really appreciate it, and these are great ways to use data, and that really hits home with a lot of people a lot more when you can say our students and our youth. And here's what they're doing or what they aren't doing and how it can affect them. So these are great. Thank you very much. All right. So just these next couple slides real quick. Not going to go into a lot of detail. We want you to actually know that these are more resources for you to use. But back on December 5th in Louisville, the Department for Public Health sponsored and put on, in conjunction with the Department of Education and the Kentucky Board of Education Health Subcommittee, we did a coordinated school health summit. Many of your health departments attended, probably many of you did. But the whole goal of the process and of the summit was to bring teams together for health and education, to work together at the school district level to develop a plan to hopefully improve their district wellness policies and how to assess their wellness policies. And we'll talk more about both of those things. But at the summit, there were over 350 people. There were 33 school district teams, which was wonderful. We had a great keynote who really spoke well to the link between health and academic achievement and how healthier students are better learners. That his keynote address and PowerPoint presentation are available on the link you see 4 bullets down on the Kentucky Department for Public Health's website. That link will also take you to the 8 coordinated school health unbridled talks. Those are basically like a TED Talk style format, representing the 8 components. So we heard from community members, we heard from local health department administrators, school district administrators, teachers. Really did a fantastic job of presenting those 8 components of coordinated school health and some resources that they utilize to address those 8 components. And then we had lots of collaboration and coordination with our stakeholders during that entire process. So know that that website there is a really good resource for the work that you'll be doing as it relates to wellness policies and school health within the schools. So hopefully you can utilize that link there.
So as we've laid the groundwork, shared with you the data, showed you the connections to what we're tracking at the state level through the Health Subcommittee, through the Kentucky Health Now plan, we are building a systematic way of improving student health and making those connections. And so as we continue to build this and we looked at this new grant opportunity and some things that we had piloted over the last few years, we really wanted to move past what had happened in Kentucky, even with some of our coordinated school health funding or other organizations that have been funding school health initiatives. And we said we really need to put a sustainability plan in place to where these programs and efforts are not just hit and miss, here today, gone tomorrow. And so as we looked at that, we said we really need to Kentuckyize a plan and a vision, and that's what we've done with the new CDC grant funding with the 1305. So what is that plan to improve? And that's where we developed this concept around Kentucky SHAPE Network. SHAPE is a simple acronym: school health and physical education. we look at that and said, all right, this is the Kentuckyized version of what coordinated school health is going to look like over the next 5-10 years in the state of Kentucky. And as we thought about that, what were our implementation plans? What were we going to do to move this forward? And so that's where we want to share with you before we get into the specifics of some of these programs of what's happening big picture right now as we starting the implementation after year 1 of this new funding with Kentucky SHAPE. The first thing we looked at is what the Department of Education has done and continues to do with leading implementation around Common Core standards. Rather than just one entity in Frankfurt trying to train the host state, the key thing that happened with Common Core is the networks that were established for training, professional development, and technical assistance through each of the regional education co-ops. And so with our SHAPE network, that's exactly the same process that we are mirroring and have already begun. This past summer, we hosted 4 of these trainings across the state. We hosted one in Hazard down in the Quebec region. We hosted one with KEDC up in the Ashland region. We hosted one over in Oldham County with OVEC. And then lastly down in Bowling Green with GREC. These trainings were open to anybody in the state. So we did have people that traveled great distances to attend these. So even though it may not have been their region where their school base was, they were still able to come to these free professional development events that we were hosting. Give you an example, we did have a food service director from all the way over in Morgan County, just below where I live in Moorhead, that drove all the way to Bowling Green. That was the last training of the summer, and he had missed the other date. And so we did have a lot of buy-in from people that really wanted to do some of the things that we're aligning school health and the things we're covering with school accountability. And that's really the essential piece that we want to get across, that schools need you now. And we've changed that conversation at the state level. We've changed that conversation for local health departments. No longer are we trying to convince schools, but because it's a part of their accountability score, it's a part of their program review process, people are now asking for help rather than us trying to convince them they need help. And so this SHAPE network just allows us to have a strategic plan in place to better do that. As we move forward from here, the first thing that we're also going to be doing in each of these 8 regions is hiring a specialist. So we'll have an elementary specialist and a middle school, high school specialist in each of the co-ops. These people will not be full-time employees. We would love to have the grant funding and the amount of money to do that, but unfortunately we're working with a rather small budget for our implementation plan. So what we're looking at doing is finding strong school champions that are doing these things that we're going to share and talk about, and that way they can kind of be our regional contact. So we're going to pay them equivalent to a coach's salary. It's going to be a stipend per year. So by the end of this second grant year, we will have our SHAPE network will consist of our 4 state health staff, in addition to these 16 regional specialists that are in each of the regions. So these are going to be great people to partner with, to bring awareness, and to work on the buy-in, and to further align the work in a bigger way. Another thing we said is we didn't want to recreate the wheel or start from scratch. And so as we looked at the SHAPE network, we have 2 very simple goals that we're doing with schools to engage them. So the SHAPE network is working specifically as an intermediary with the Alliance for a Healthier Generation, and also our partnership with Humana Vitality. Both of these are very strong organizations that we have partnered with for the last 2 or 3 years. And so our new SHAPE network approach just continues to build from that. So even though we sit here in Frankfurt as a staff of 4, we have 2 full-time employees with the Alliance that work directly with schools. We have a regional manager that's here in Kentucky. We also have a network person. So they have 4 full-time employees. Humana Vitality has another 10 full-time employees that work as regional specialists. And so we're in constant communication with all these people around how we are collectively working to improve school health environments. So many of you have done some of those events with us, and so we have very strong collaboration not only between our agencies, but between these 2 great partners as well. Each of these programs we will go more in detail over the course of this training day. Another important point to mention, if you did not get the email this morning, our agenda just goes to noon. So that alleviates some of your fear of thinking we're doing this all day long. Because this is ITV format, we chose to just do a 9 to noon, and we may hopefully finish up sooner than that. So we'll start getting into some of the specifics on this around the Kentucky Shaped Network and how we're working to get that buy-in, and then what these programs specifically look like. If you do not already have a laptop or computer access there with you, that would be an important thing to have as we get ready to move forward, because we want this to be hands-on practice with some of these. And so we're going to go into these websites and look at that, and not just sit here and tell you about it, but we want you to actually get in there and see what's there as well, and how to do that and get more familiar. So as we got this plan in place, we also kind of had to look at what's required. What's going on in Kentucky schools, what has occurred in Kentucky schools, and we have a few things that we want to build from as far as actual mandated requirements or legislative policy. The first one is, and we quote the statute there, KRS 160.345. That came out of Senate Bill 172 a number of years ago. It's actually part of the Site-Based Decision-Making Council statute, so it requires all schools to have a site-based council. But in that later part of that statute there, it mentions that all K-5 schools must have a wellness policy and a plan for moderate to vigorous physical activity. It also says that schools may count up to 30 minutes per day as instructional time for physical activity. Now notice that key word there. It says that schools may use that time. So there is not a minute requirement in the state of Kentucky for physical activity or for recess, but there is an allotment within that statute that allows for that time to count as instructional time. So schools do have that option. So if that's something that you run into with schools or in discussions about students not having those opportunities, those are local control. Those are Site-Based Decision-Making Council policies and procedures, but they can choose to use that if they so choose. The other one is the KRS 158856, and that is the one that requires every single school district in the state to do a report, and that's what kind of helps us implement the Federal Nutrition Act, and basically requires a district level wellness policy and an annual report on the nutrition physical activity environment. We are constantly working with our school community nutrition folks to enhance this process, and so in just a minute we'll kind of show you how we're linking the connections. And that part was really important for us, knowing that we have 173 school districts, and we knew that is something that every single district had for certain. So when we look at lack of policies and mandates in our state, that is one that we knew we could build on, but we want to make that actually a living, breathing document. You know, earlier I said policy is not what you say, but what you do. And we realize that many of those policies out there are just pieces of paper for compliance, and that's what we're really focusing our efforts on, of how to improve. And then lastly is this part around the Kentucky accountability system for what we call program review. Health and physical education standards in Kentucky are what we refer to as practical living. And so within this statute, it's the new accountability process for schools. So program review has been a great platform. You'll hear us reference program review and coordinated school health committees and wellness policies. So while we lack in policies, what we have been able to do within program review is have a document that we know that all 1,200 plus school sites in the state of Kentucky are at least looking at this document, evaluating themselves and saying, do we have a coordinated school health committee? Do we have a wellness policy in place that's implementing our district policy? Are we providing opportunities for students to improve physical activity in PE? So as schools self-report on those are where they're looking to improve. They're ranking themselves, they identify evidence, and so that has really been the game changer for us. It's not an end-all be-all solution, but it definitely has changed the way we frame the conversation around coordinated school health, committees, and wellness policy. So we'll kind of show you those linkages as we go through this and how we're working to work with food service directors and other school staff around how these systems go together. So just some linkages. Program reviews where we start at. That is where you're going to get the buy-in. That is a buzzword. When we work with our Alliance for Healthier Generation staff in Kentucky, the Healthy Schools program, we align that tool to program review expectations. And so when our program managers go in and recruit schools and districts, the message is we're not here to put another program on your plate. We're here to help you with what's already on your plate. And so that strategic alignment we've done with the Healthy Schools program into program review expectations is really critical and crucial to getting buy-in for why it's not just another program. You work with schools, and you've been in schools, you know they have a million different things on their plates and more things on their plates than we know how to deal with. So what we've strategically done within our SHAPE network approach and our partnership with the Alliance is say, we're not here to put something else on your plate. We're here to help you manage what's already on your plate. So that's very key in starting the conversation and getting the buy-in from local schools. The district wellness policy, I just came this summer from the School Nutrition Association, and over again, what was repeated to the food service directors and the cafeteria managers, that district wellness policy is just a template that it needs to be a living, breathing document. So there's a golden opportunity right now to get in that wellness policy conversation of things that are going on about how do we make our wellness policy in our school district something that actually impacts students, not just something that's in the district office in a folder, but truly a wellness policy that's impacting student achievement, discipline, attendance, and all those other academic outcomes, as well as those health outcomes. And then ultimately down to the school level wellness policy. And that's where we really say the rubber really meets the road. So there is the expectation in program review that every school in the state of Kentucky has a school level wellness policy. That's adopted by the site-based council. Here in 2 weeks, Stephanie and I will be presenting at the Association of School Councils, and that's one of the issues that they invited us to come and talk to all site-based members in the state. So if you're on a local site-based committee or you know people in your community that are, and they will be attending that conference in Louisville coming up the middle of this month, let them know that they will walk away with a drafted school-level wellness policy with that workshop that we're doing at that conference. So it really is driving, changing the conversation. We have groups just like school councils that reach out to us to say, come help our membership with these issues and areas, and so that has changed it a lot. Before we go to this next slide, one of the things you got this morning, I'm going to hop over to the internet for just a second just to show you where this is, and that way you can have it to print as well for our resources. And so once again, I don't want to just pull a resource up without showing you where it came from. So I'm going to go back over here to our Department of Education website. So if you're following along your computer, you can do this as I go through the steps here. Unlike Stephanie, that was brave enough to know when she typed in YRBS in the search box it came up, I'm not so sure about our search engine, so I'm going to go through the manual way over here to get to where I want to show you, and so see the other areas we have here too. So over on the left side of the KDE website, you'll see curriculum content areas. You hit the drop-down menu, and luckily we're at the top of that list since we start with C. So curriculum content areas, and you'll see coordinated school health. It brings up a further drop-down menu over to the side. So with coordinated school health, if you'll go over and hit the overview. So this will take you to kind of our main website page that is currently posted. So within that coordinated school health site, you'll see that we still have Vicki listed because we've not updated it since June, obviously. But in the overview section, there's just some background information around coordinated school health, around the funding areas that have come out of CDC in the past, what the 8 parts of coordinated school health are. But the part I want to take you down to for this important resource, and this really has become kind of our go-to piece as far as coordinated school health and connecting the dots. You'll see that here down the middle under the section how to create your CSHP. You'll see 4 documents listed. We'll be referencing these 2 here in just a few minutes as well, so know that they are on the overview page as well. But here's the one I want you to pull up, and that's one I'm going to reference back in the PowerPoint in just a second and go into further detail. But this is the one that really has identified getting the buy-in and connecting the dots. So we're going to go through this document back in the PowerPoint in further detail. But this is just kind of a one-page document right here that kind of looks and aligns the 4 things that are required in the Healthy Hunger Free Kid Act. So we're going to look at that in the PowerPoint in just a second. And then most importantly, we kind of Kentuckyized that and said, these are things that happen at the district level. Here's things that happen at the school level. And all these things in the blue box are specific language from program review. So here's what the federal government's asking us to do with wellness policies. Here's how the state processes with program review built into that federal process. And so merging those 2 conversations, once again, we're not asking schools to do more. Here's what you're required to do on both sides of the fence. Here's how both of these 2 things go together and work hand in hand. So I'm going to flip back over to the PowerPoint, but I just wanted to show you where to find that at. If you got the email this morning, this is one of the attachments that we sent in that. This is one that we use a lot with schools.
Oh, you have to go from current slide to now.
All right, so we know that in 2010, the federal government, the Child Nutrition Reauthorization Act was passed in 2010. The first part of that act required for changes in school meal pattern. So that's all the sodium things, that's all the amounts of vegetables, whole grains. That was the first part of the act. The second part of the act was around what's being implemented this past year, and it's full swing around smart snacks and competitive foods. So there was new restrictions and guidelines on what could happen outside of the school meal day. So we had changes to school meals, we had changes outside of school meals, and the third and final piece of that, which just became finalized as of July 1, was the requirements for wellness policies. And just like with Kentucky, many other states were just simply using a wellness policy for compliance. We passed it, our board said yay, we did it. Were PE teachers involved? No. Were health departments involved? No. Were parents, community members? Oftentimes not. And so what the federal government looked at doing, and this is what we've been practicing through a number of partnerships the last few years because we've known this was coming, and so that's really where this sheet came out of and why it's so instrumental to our work and buy-in. So there was 4 big goals that came from that. Involving stakeholders in the development of wellness policy. We don't want it to just be a one-person show. We want board members involved. We want parents involved. We want health departments involved. We want students involved. So we truly want to make sure that when we implement these new requirements, it truly is stakeholder involvement. The second thing within those policies was they wanted specific goals for nutrition, physical activity, and PE. So that needs to be very targeted things that are happening around each one of those 3 areas of what's happening in schools. Another key part of that, and that's where it comes into that WellSat tool, measuring implementation of progress of the wellness policy. So not only do we want you to pass the policy and have goals in it, but we want you to measure how well you're actually doing it. And the fourth and final piece is public reporting of implementation. That's a piece that Kentucky's already had previously, and what we're doing now with some of the tools we're going to share with you today is working to improve that process, to make it more transparent, to make it more at the school level, and so we're going to share some of those things with you as well. So as I mentioned in the document, and that's the reason I wanted you to know where it was so you could print it and have a hard copy, that's what it looks like, and that's how we're connecting these 4 things. So we're going to look at each one of these 4 more in detail from this sheet, and then always everything we have around these 4 goals always comes back to things that are already expectations in program review. So merging these 2 concepts together. So first of all, involving stakeholders in the development of wellness policy. That's exactly the reason this MCH funding was given, to help schools with coordinated school health. We don't care if you call it coordinated school health committee, a wellness committee, a school advisory committee. It's a collective group of individuals. We don't expect you, the first thing we want you to do is find out what's happening in the schools already. If you need help knowing what they reported on program review last year and where they scored themselves, send Stephanie or I an email and we can help you find that and get that contact so you know if they said no implementation or maybe they're already distinguished. So we have data on that because they self-report on that every year in program review. So we want you to look at what's happening at the district level as well as at the school level. Obviously, we're very careful in this, depending on what district you're working with. That conversation changes as far as what that council looks like. If you're working with Jefferson County versus working with Bergen Independent, that district council is going to be two totally different animals. And so that's the reason we wanted to offer some flexibility as far as what the district council work looks like versus what the school level committee looks like. And so we're going to talk to you about the Healthy Schools program in just a few minutes, show you how to log in, and show you how that aligns to coordinated school health and helping the schools. The second thing is around the goals for Nutrition Ed, PE, PA. So once again, we're going to drive schools towards assessment, doing an assessment of their environment. There are 3 tools that have historically been used for school health assessment. One is the CDC School Health Index. The other is the Healthy Schools Program by the Alliance. And the third is the USDA's Healthier U.S. Schools Challenge. We've had school districts across the state that have used all 3 of these in different capacities. Obviously, within our SHAPE network, we've been putting a lot of focus on the Healthy Schools Program, simply because a lot of the things, it's data-driven, it's online, it's a free assessment tool. We're able to collect state aggregate data from that. The other cool thing that happened, and I want you to show you, is this is one of the big challenges that we've had in school health for a while. There's so many different assessments for schools to choose from. So as you look at these 3, it'd be nice if we could start getting some coherency between the assessments. Well, as of about 3 weeks ago, the Healthy Schools Program actually adopted the School Health Index as their assessment. So we'll take a look at that in just a few minutes and take a live look. So there is a very strategic alignment now between the School Health Index and the Healthy Schools Program. You'll see that reflected when Stephanie goes through the website in just a few minutes. So once again, there's some national partnerships occurring that we see as a great benefit to schools that are very busy and many things. And so once again, instead of having so many different things for them to do, it's a consolidation that's happening with national partnerships. The other thing important with the Healthier U.S. Schools Challenge is they've also done a partnership with the Alliance. If you're recognized with the Alliance, you automatically are recognized with the Healthy Schools Program that the USDA does. And so once again, there's some very strategic things that have happened in the last year or so with these 3 assessments. And so that's the reason we're glad that we've had the partnership with the Alliance that we've had, and we'll continue to do that and see that alignment with these assessments. Measuring implementation, and so that's the other thing that the tools will help schools to do around the wellness policy is looking at semi-annual reporting on school health assessments. So using those committees that you're going to help create to report back to district health staff or the district council and actually get school level data, sharing school level data so it's aligned to program review, but that data also helps you to look at what's truly happening in their wellness policies and if it's occurring. And then lastly is that public reporting of implementation. Each superintendent is required to have an annual report given on the nutrition and physical activity environments. And we've had that. That's a part of that 158 law for a while. So it actually, the statute says that 60 days, at least 60 days prior to January 31st, a local school board must have a report published to share with community members. So that's what we're looking at, using the assessment from the Healthy Schools Program to inform this reporting process to where district board members can actually see what's occurring school level by school level, so we can really make some informed data-driven decisions on what goals and what policy things need to occur to make sure they're better implemented across the district as well as in the individual schools. So these 4 things, as we review, involving stakeholders, which is where a lot of your work is going to occur, but then helping to build these other parts around the assessment and completing the assessment, measuring implementation, and public reporting. So on that paper, the other thing you find is the blue areas that I noted previously. Each one of these bulleted items are specific things that come out of the program review. So we're already asking schools to do them. Every school in the state is reporting on these different measures in some way, shape, or form. And so as we look at those different measures, we're showing how these measures align to what's being asked at the district level with wellness policy reporting requirement as a result of the new Healthy Hunger Free Kid Act. These are all very new conversations that we continue to build. So that's the reason we're excited to work hand in hand with you guys in any way, shape, or form. And so this is the training today. We're just looking at that awareness, why it's important, getting you an understanding of what schools are doing and those expectations, and then how we can collectively work with you to move forward to help the schools and districts that you're working with.
And I will say, I've been working with a district recently, and they're trying to get something together at the district level, trying to get some people involved. They know they want to improve some health and wellness in their district. They know they need to look at and improve their wellness policy. They just were kind of floundering, didn't know what direction to go to. So I took this document that Jamie just showed you a second ago, took this to their committee meeting, and it really opened their eyes and made them understand, okay, this is what we need to be doing at a district level, and this is what the schools need to be doing, and this is how we can help them. So this document really does help put in perspective, especially those blue squares right here, what they're supposed to be doing. We hear all the time from schools, staff, health and PE teachers, I have a coordinated school health committee because basically program review told me I needed to have it, but what am I supposed to do with it? So this gives them some direction. It goes back to that assessment, some action planning, some implementation and evaluating. This helps them also. So I highly recommend if you're on a committee or we're on a committee and they just weren't sure what direction to go, this could help them. And it shows those, again, those connections to the program review that they're held accountable for. So let's look a little bit more specifically at the program review. So this is another buy-in piece for you to get into working with the schools and helping them. This is in the Administrative Leadership Support Monitoring. This document, if you go to the KDE website in the search bar, program review website page will come up. Look for PLCS program review, and you can see what schools are held accountable for. But this is taken directly from there. This is a standard that's titled Administrative Leadership and Support. It's a demonstrator looking at policies and monitoring. And then when I say characteristic, that's what's in those boxes at the bottom of the screen. So this is one characteristic, and this is how, and then when we say how they're implementing it, this is how they score themselves. No implementation, needs improvement, proficient, or distinguished. So this one is showing where there's a connection to not only the district wellness policy, but the school level wellness policy. If you look in that proficient column, which is where all schools are striving, many want to be distinguished, but in essence, they need to be proficient, want to be proficient. So they're looking at implementing their district wellness policy, which we found a lot of school level people aren't aware of, not sure where to find it. We'll talk about that in just a minute, but this brings to light the fact that their district does have one, and then that they're implementing it via a school level wellness policy. Jamie mentioned that KRS a while ago, that elementary schools, K through 5, are required by state reg to have a local wellness policy. That is not a requirement for middle and high school, but to be proficient in this characteristic for program review, they're supposed to have one. So that means that all school levels are now looking at developing a local wellness policy. And then goals for school wellness are included in their comprehensive school improvement plan. So the focus that the SBDM outlines for each school year. So this is the connection in program review to wellness policies. This one right here, this is one place where coordinated school health committees are mentioned. This is in the curriculum and instructions standard under physical education demonstrator. So you're looking at a characteristic and look in that third column again, which is proficient. And it says a coordinated school health committee utilizes a comprehensive school physical activity program. So those are two things that you'll most likely be working with your schools on. And this is where these are mentioned in the program review, again, so that you can point them out to let schools know that you're going to be helping them address these things, not, again, adding more things to their plate. So looking at increasing the physical activity opportunities throughout the school environment is the overarching goal for CSPAT that we'll talk about a little later. So right now, this document here, I'm going to go out of the PowerPoint for just a second and show you again on that web page that Jamie pulled up earlier. Let me go back to, oops. Sorry, wrong page. All right. Back to the KDE homepage again, curriculum content area, coordinated school health overview, and then if you scroll down, we're actually going to have you, hopefully you can pull this up, or maybe you have the PowerPoint in front of you, or we'll have the document up, but we're going to make this kind of an activity for you right now. So looking at, we're going to start with this coordinated school health district council planning. So if you will pull that document up, if you are able to. So this is a resource that we have on our webpage for developing a district school health council. A lot of times people aren't sure exactly who to get involved. This gives you examples of who to involve. You could work with the school district to help fill these in. But actually what we're going to do right now is we want you to take just a few minutes. If possible, start filling in actual names of possible contacts that you have within these categories that you could be working with to develop a committee at a school district level. And you may think of others, and that's great. Go ahead and add them to this list. But I will say that this food service director, food service staff right here is going to be a real key component working at a district level because they are the ones that are responsible and get reviewed on the wellness policy that they're required by the federal law to have. They will definitely want your help when addressing this. So take just a couple minutes and begin, and if you're with someone else, discuss some possible people that you all have to include on the council with the district that you plan on working with.
Stephanie, it's Emily again. Okay, how did you get to that page again? I'm looking at the KDE website, and I'm on school health profiles. Is that the right page to go to the link?
No.
I somehow missed a step.
No problem. Okay.
You're close, yeah.
Yeah, it's
Coordinated
not too far off. So actually, I'm going to take you through the process again. So go to the Yeah, so go to the Kentucky Department of Education homepage, which is education.ky.gov. On the left-hand side, you see curriculum content areas.
Okay.
Click on that. The menu pops up. You'll scroll down until coordinated school health is highlighted. And another menu pops up. Okay.
Okay, I'm on the home page and I go to curriculum and content areas, correct?
Correct. And does a menu pop up and coordinated school health is the fourth thing down there?
Somehow I missed that. Okay.
Does it show you that, coordinated school health?
It's coming up. Curriculum and content areas is what I see
Okay.
on the top of my page. And then you said go down to where?
It should say coordinated school health.
Do you see that on there?
It's not on ours.
I don't
Okay.
see
Wait,
it.
right there, coordinated school health, right?
Where?
Up, go up, down.
Down.
Right
Oh,
there.
there it is.
Okay.
Sorry.
And then
I got
another
it.
it's okay. And then another menu should pop up, and you should click on overview.
Okay, somehow I couldn't see that. Overview.
And then that should be our main page that you would scroll down to find those resources. It's a little bit further down the page though, under how to create your CSHP.
I'm not seeing overview.
Okay, now I'm on that page that says coordinated school health with the big logo. Yes, so I scroll on down.
Just scroll down
Okay.
past the program review logo,
Okay.
and then you'll see in bold how to create your CSHP. And there's a couple links under the bulleted items, and you're going to click on CSH District Council Planning. That's the current document we're looking at.
School health profiles, training opportunity. I'm trying to find it.
No problem.
She's scrolling down the other side.
What's that?
She's scrolling down that.
Keep going further down the whole web page, not the menu on the left.
Right, I'm going down, and right now I see
School health index. Is that
school
what
health
she said?
index. Let's see, journal of school health website, health and academics, school health index. Is that what I wanted?
Nope.
A little bit farther.
Oh, further. Okay.
You just missed it.
Oh.
How
Right
did I
above where it said Journal of School Health website.
It was
I
right
see
above.
it. Ah,
See it?
how can you
There it
see what
is.
I'm doing?
Right above. And
Oh,
right
okay, now I'm on Journal of School Health. Is that what I?
go back.
No,
Oh, go back. Okay, how could you all see what I was
Right above journal.
we did.
doing?
we
Okay,
just did.
CSH. Which one now? I'm sorry.
District Council Planning.
The second one. Dang.
The
There it
second
is.
one. Correct.
Okay. Is that mine or?
It was not ours, I promise. I don't know whose it was.
Security
All right.
warning.
Technology's always great.
Oh, there it is. So now I type in.
All right. So now
Yay!
you can use this as a worksheet to start planning and putting in actual people that you are aware of that would be most likely on this council.
Okay.
All right.
Thank you.
I think.
Should I be typing it in right now?
It's
No,
on this.
you can, yeah.
I mean, is that what you're waiting on us to do?
Yeah, we were having you do that, no problem. You can use this later. If you can't think of names right now, that's okay. This is just making sure you have a worksheet.
I already wrote them down a while ago. I was thinking ahead.
There you go.
I read
All
y'all's
right.
smile.
Okay, and we know who this is.
Health teacher, me.
All right, go
Thanks,
ahead and mute your mics again for me. We'll get started.
Okay. You
Back.
got-
Thanks.
How you mute it? Just mash it.
All right. All right, so hopefully you at least got thinking, maybe talk to each other about some possible members, some champions that you know of that would be involved at the district level, and then knowing that those tools are there on the KDE website for you to help plan with. So that one that we pulled up was for a district council. This next slide here, and again, this document is back on that webpage, is for a school level coordinated school health committee. You're going to see a lot of the same titles here, but you're looking for these people at the school level versus people at the district level. There may be some cross, same people on the same committees is always a possibility. You probably find yourself doing the same thing, especially if you're working in a district that has many schools and they're wanting to involve the local health department on their committees. So you're probably aware of this. But this just helps bring it down to the school level with a couple other possibilities. So these planning documents are here on the KDE webpage if you need them. All right.
All right, and before we do that, we are in violation of our current wellness policy because it's been 36 minutes since we were up and moving. So I'm going to ask everybody to stand up. And as you stand up, I'm going to take us to a resource and show you where to pull a school level resource from. And then we're actually going to do it as well. Here in just a few minutes, Stephanie will be going into the Healthy Schools program. So all I'm going to do is she'll show you how to actually pull this in and go straight to it in a little bit, but I'm going to go directly in. So these are all resources listed within the Healthy Schools program, and like I said, we're going to back up and show you how to do this later and log in and create a whatever. But you'll see these are all free resources and videos that are posted. They have fitness training with Bob Harper. So these are easy ones for classroom teachers to pull up and use. They have some yoga. There's a fitness party with Zumba. And then Billy Blanks has done some Taebo, and notice that they're leveled out for elementary, middle, and high school students as far as level of experience. And so we're going to just do one of those for about a minute and just get blood flowing back to the brain and away from the bum. So hopefully this will work for us. If we have the sound, that'll come up.
The audio is not
Are you guys ready? And go. 1, 2, 3, 4, 5, 6, 7, 8. Good job. Now, I need to hear you do a little bit louder. Let me hear your power. Ready? And count. 1, 2, 3, 4, 5, 6, 7, 8. Good job. All right, now, let's do our first exercise. It's going to be a warm-up. We're going to get those legs strong so we can jump high, walk strong, and make our legs last forever. Our legs are like car tires. So put your hands up by your chin. Now, when I say 1, you're going to squat down. We're going to do 10 of these. Ready? Go. 1, count. 2, count. 3, that's it. 4, let me hear you count. 5, 6, count it. 7, and 8. Good. Hold that position. Now, let's do it one more time, but give me a nice strong count. And let me see some power in your eyes. Let me see some power in those eyes. Are you ready? Let me hear you count. Ready? Go. 1, count. 2, that's it. 3, count it. 4, 5, count it. 6, count it. 7, count it. 8. Good job. Now, bring your legs together. Now let's do another exercise that's going to help you with power in your legs and make your legs even stronger. Open those legs up. Put your hands up here, like chin in the cage. Now drop down. Hold that position. Now, let me see how much power you have. You got to hold that position. You got to become the Statue of Liberty. Ready? Hold. Now your legs are going to feel like they're going to give out. But don't quit. Let me see your power. Because I know you got some power. So hold it there. Your legs are going to feel like they're shaking. Do you feel that right now? Yeah. Good. That means you're going to make those legs stronger. Stay there for 5 more seconds. Count it. 1, 2, count it. 3, 4,
5. Good. Shake those legs out. Good job. Move around. Shake it out. All right. Now, next exercise. I know you guys know how to do this. Your favorite. Jumping jack. Put your hands on your hips. I say 1. I want you to come up. I want you to hold that position. Open position. Ready? Go. 1. And back. 2. And back. 3. And back. 4. And back. 5. And back. All right. Let's try it. 10 of those. Are you ready? Count out loud with me. Let me feel your power. 5, 6, 7, go. 1, count it. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good job. Now, you got your chair, right? So just sit on your chair.
All right, thank you guys. Good job. And just like with students, when we keep students in the classroom and we drill them with book work and worksheets and paper, just like many of you guys out there were looking extremely bored. Now I see smiles, I see people laughing, and that's exactly what, not only for the health outcomes, but also for the learning outcomes as well. And so we've got to remember to make that a normal part of what we do, not only in the way we work, but also promoting that in the way that schools function and work as well. So thank you guys for participating, and we're going to slide back over to the PowerPoint now. So as we build this, we said wellness policy is a key part, and so we're going to do a little activity with District 1 and show you where to find district wellness policies, or the majority of the district wellness policies. The Kentucky School Boards Association has an online policy manual. All policies are listed, not just wellness policies. And so we're going to take you to that to show you where to find the school districts you're working with, as well as other policies or comparison that you may want to look at neighboring school districts and see who's doing what and whose are different. So that website is www.ksba.org. That's just the Kentucky School Boards Association. So we're going to take a live look at that and actually pull up a wellness policy. And then this will be a resource for you to know where you can find your school districts as well. So this is the home page of KSBA. You'll notice a number of tabs across the top. And we're going to go to the policy tab. So all the way across the top, here where I have the cursor, there's the policy tab. And so I'll click the policy tab. And then there's a couple ways to get into it, but then I'm going to leave my cursor on the policy tab. And you'll see that the second menu item down underneath that tab is online manual service. And that's what we want to do. All school districts, except for one, subscribe to the online manual policy service KSBA offers. So there's a 99% chance that you're going to find what you need right here or through the district website. We'll show you that as well. So as I click the online manual service, you'll see it kind of talks about that service, but then right here's the next link we want over here in the top, access your online manual. So once I click that, so I did policy, online manual, and then now I want access. So to access, I get a drop-down menu. So from that, that's when I get my listing of school districts. So here's all the different school districts that are listed. We have found that not all of them are completely listed here. I'll go through that in just a second if you happen to find your district that's not, of how we go in the back door to find that. But the majority of them are listed here on the drop-down. For whatever reason, not all 172 that subscribe to the service are listed here. So for an example, I'm just going to go with the first one right there and go to Adair County. So there's the drop-down. I'll click Adair County, and now what I have access to is every single policy that the school board in Adair County has passed. Over on the upper right-hand side of this website is another drop-down menu. And so there, as I mentioned, all policies are listed. The policy that we're looking for student wellness is always going to be Chapter 9. So I'm going to go down to Students, Chapter 9. And then there's a secondary menu that pops up for drop-down. And then I'm looking for 09.2. That is Student Welfare and Wellness. So every single school district in the state, this will be the same process of where you find it. They're all numbered and lettered the same. So 09.2 is Student Welfare and Wellness. These are all Word documents. So once you click 9.2, it's going to ask you to either save it or open it. So I'm going to open, and then it'll take just a second for that policy to pull up. And there is Adair County's student wellness policy. Now, what you'll find right here is a couple things that I will highlight or discuss. And what you see right here is some background information on the board and some of the federal requirements: nutrition, education, promotion, monitoring, progress report. Page and a quarter, maybe. I will tell you that there's a very strong likelihood that that's exactly what you're going to find when you find the district that you're working with. This policy right here is pretty much the template policy that school districts have used in the past. A repeated message I mentioned earlier is this was only to be a template. The expectation in district reviews that happens with school compliance, with school meal compliance, is we want to see living, breathing wellness policies. So in the past, school districts have gotten by with this, and there's nothing wrong with what that was. That was just our compliance checks, but this is something that we're putting emphasis on and will continue to work with food service directors and district health staff to improve this. And so this is an ongoing part of why your work here can be so important, because this is what's driving the work and the conversation. We want it to be more than this. But I will highlight a few things that are already listed. So even within this policy that's very, very vague and basic and lacking a lot of detailed information, you'll see this statement right here that I've highlighted. And I'm going to blow it up just a little bit so we can make it a little bigger on the screen. A process shall be implemented to engage students, parents, physical and/or health education teachers, school food service professionals, school health professionals, school board members, school administrators, and other interested community members in developing, implementing, monitoring, and reviewing this policy. Every policy in the state has that language. In a nutshell, what that says is our district is using a coordinated school health process to develop, implement, monitor, and review this policy. So while our policy has said that, very, very few have done that. That goes back to the very first thing I said with our wellness policy and our 30-minute rule. Policy is not what you say, but what you do. This is what we want to bring to life. This is the role that we want to help you to establish with local school districts as a community partner. So your policy already says that what we're promoting and what we've aligned in program review, that they've already wanted to do that. So now we just got to bring that to life. The other part that I want to look at is the progress report and the monitoring. And so we're going to take a look at that when we go back to the PowerPoint in just a second. So we're not even asking districts to change policy right now. We're just saying, hey, let's do what we already said was happening. And so we can bring those areas to life. Changing policy can be a goal or outcome you may want to work on, but let's just bring to life some of the things that are already in the written policy, even if it's that 1 1/4 page template that KSBA and the district adopted and nobody's really read before. So I'm going to jump back over to the PowerPoint. And look at this issue. So I said this, now you look at this language here that's on the screen, monitoring and progress. So we're going to go into the WellSat tool and talk a little bit about that and the role that it has in this. And know that the WellSat is a tool that's going to help what's already said in your local wellness policy. So even if your wellness policy is different than the one we just showed you, if it is different, it's probably going to be a better one because they've at least had a more thorough conversation of adopting some things. So at the very minimum, we know that all the policies are saying this with monitoring and progress reporting. So the superintendent is in charge of monitoring compliance. At the school level, the principal designee will monitor that compliance as directed by the superintendent. And then in the reporting, the district shall periodically measure and update the public on the content and progress of implementation. All policies in the state say this. We've not done a good job of monitoring that and doing that. That's what we're improving on here. That's the reason this MCH funding is important, to help districts build this conversation. So what are they expected to do in the progress? Are we in compliance? Well, if your district policy said you'd use a coordinated school health approach, but one person's only ever done it, there's a very easy thing to talk about. No, we're not in compliance because we never involved stakeholders. Also, it asks, and this is where the WellStat tool comes in, what is our district, how does our district measure up as provided by recognized state and national authorities? So when we go back and look at that 1 1/4 page policy, how does that measure up compared to other districts in our state as well as in our nation? The WellStat tool is going to give you an actual tangible score for that policy. And then last, part of that public reporting is a description of measurable progress on reaching the goals, identifying and how to address the gaps. So you have things, even with a 1 1/4 page template policy, probably have some things that you can automatically start working on to do. So that's the reason one of the tool options we gave you was the WellStat. The WellStat was developed by the Yale Rudd Center. It can be found at www.wellstat.org. And it allows you to create a login. People that came to the summit, the Coordinated School Health Summit, this was a prerequisite to coming to that summit. So we had 33 teams there, and this was a prerequisite that we asked schools to do and districts to do to even attend the summit. So this is something that's it's a pretty easy tool to use, and it really gives you a walk away for addressing what's already in your current policy at the district level. Also, we'll provide you with some targeted areas for potential areas to include in your policy moving forward. So what's it look like? There's an email and password to log into that. So here's an example of some screenshots that we did. This is something that we're not going to spend a tremendous amount of time on it. It is pretty self-explanatory, but we're just going to quickly walk through that to know that this is an option if you choose to start at the district wellness policy level. This is the tool, the direction we want you to go. It is evidence-based. It is one of the, and that's the reason it was listed as a potential strategy that you could use. So you name the policy, you code it, so you pulled it up from KSBA, and now you're ready to do a new wellness policy assessment. So how to rate the policy statements, it gives you, and this takes you through step by step of how to do that. So each area, each criteria on wellness policy statements are going to be rated a 0, 1, or 2. So when he gives you a statement, if it's not mentioned, it gets a 0. If you feel it's listed in the policy, but it's weak, you're going to give it a 1. If it meets or exceeds the expectations of how the policy is written with that criteria, then it gets a 2. So you're going to go through and give 0, 1s, and 2s throughout, so it gives you the criteria. So what's the criteria look like? The criteria for the assessment gives you very specific things. I will tell you, I've been doing some work in Maryland, and Maryland is light years ahead of us in this area. Their wellness policies can be 4, 5, 6 pages long, because when you start getting into some of these details about what actually occurs with student health, you know, it becomes a longer policy. So as you look at this, nutrition education is a subject area. There are several different sections that you will evaluate. You see these over to the right side. So you do nutrition ed, you do USDA standards, nutrition standards, PE and PA, and then it also asks you to score how your policy covers the evaluation. So you go through 0, 1, 2. This is good to do with a collective process with your district council, because it can be an objective process. So as you look at that, you want to have others giving feedback into this. So it is good to work with 2 or 3 people to do this process. 0, 1, 2 on each area. You click through the sections. And you'll see you can also rate it by the grade level in some of the areas. So if it's in the different areas, making sure it's elementary, middle, and high. So you click through your sections. It'll give you a scorecard and show you how far you are along in each of the sections. And then ultimately what you get is a review. Review your scorecard. And so then once you click the review button, it gives you an analysis of the numbers that you inputted. What you'll get is a total comprehensiveness score, as well as a total strength score, and it explains that in the website, how that works. You can also print that You can also email that, so you can enter yourself as well as your other district contacts, your food service director, your health coordinator, whoever your team you're working with, so that everybody gets that. You can email that directly to the superintendent if you so choose, if you've created that line of communication. So that's how easy the process is to get a tangible score. We also have sample policies that we would be glad to help you provide that go far well above and beyond some of the template policies we have out there now. There's some other districts that we can share with you. Doing this work over the last few years, we do have a collection of a list of districts that have a fairly solid district wellness policy. So if that's something that you would like in doing this work, just reach out to us, email us, and we will be glad to connect you with those districts that you can compare yourselves to. That is the WellSat tool. Are there any questions with WellSat?
Or policies in general?
In the event that the district you chose is not on that drop-down menu with KSBA, the other option you can go to is to go straight to the school district's website, and generally the policy manual is listed there. So there are a few that we found that are not on the drop-down menu, but the way we've always got around that, we go straight to the school district website and pull it up that way, and we were able to access an online manual. It takes you in the back door of the KSBA, but for whatever reason, some of them aren't listed. So just know that those are the two ways we always do it. We've done a lot of policy monitoring, tracking with tobacco-free schools, so that we use that same resource to find the tobacco policies as well.
Okay, so now we're going to get into the Alliance for Healthier Generation, the Healthy Schools program. As Jamie mentioned, there are 2 full-time regional program managers that the Alliance staffs here in Kentucky, working specifically with some school districts. I'm going to show you a map real quick to see, so you can see if possibly there's someone helping the schools and districts within your area with the Healthy Schools program. So this website here, you'll see the yellow star are graduated Healthy Schools program sites, which means that they worked with a program manager for 3 years, and then districts graduate once they've had that one-on-one technical assistance with the regional manager. So a lot of those are obviously in the eastern part of the state, because that was the focus when the Alliance brought the Healthy Schools program to Kentucky, was to start in the technically disparate area. You'll see the red stars in the western part of the state. Those are through the Delta Rural Project with Baptist Health. So they are basically acting as a intermediary for the Healthy Schools program with those districts. And I will say to note that the schools that they work with are only elementary level. They don't work with the middle and high. So if you're in that area wanting to work with those districts, know that going in. The green stars are list of the regional manager over in the western part of the state, J.C. Woolley. And then some of the gold, sorry, the colors, hopefully you can tell the difference, are from Tracy Thomas. She's the regional manager for the central eastern part of the state. When it says on their list, that means that these are districts that they will want to engage, necessarily haven't yet, but will want to. And then you'll see the dark stars over in the eastern part of the state are actually the districts that our team is working with specifically to work on the Healthy Schools program and wellness policies and things like that. So if you're in that area and that's one of the districts that you've chosen, we definitely want you to get in touch with us, because we can work a lot closer together with those school districts. Those districts were districts that we had to identify for our quad grant funding to target.
And just because there's a star or not a star doesn't necessarily mean there's not schools in that area. These are just different regions or counties that were targeted So there may be schools so this is not reflective of all schools that are signed up. That's just simply targeted approaches that we have or various partners have used the last few years to recruit membership with the Healthy Schools program.
Yeah, and
So, excuse me, Stephanie, so Bergen, for example, they've been working on it for 3 years now.
This is our 4th year.
This is their 4th year. So are they the orange for Mercer, or I don't see, I mean, what is that?
This, JC Willie originally sent us this map, and she did not have the independent districts obviously listed.
Okay,
She did not
all right.
use that one. So yes,
Okay.
so Bergen and Mercer I think did it at the same time. So that's why that is shaded, that they either are involved in the program or have graduated.
Okay, this is our 4th year.
Yeah.
Thank you.
You're welcome. All right. So we're going to go a few little tips and tricks. We're going to go to the internet now, and if you have a laptop in front of you, I would hopefully follow along just a little bit if possible. I should start fresh though, right?
Yeah, you probably need to log me out.
Okay. Give me just a second. Make sure that we have this. Where is it at?
There's a different window.
Oh, here we go. All right, I have no idea. Let's start again. Okay, so the website, healthiergeneration.org, is the Alliance's website. Know that the Healthy Schools program is only one program that the Alliance has. They have multiple. So a good tip to getting into the Healthy Schools program is the web address you want to use that's listed in the PowerPoint is, if I can spell it, schools.healthiergeneration.org. So instead of just doing healthiergeneration.org, you want to put schools in front of that, so schools.healthiergeneration.org. Hold on just a second. This would not be what you normally see. Okay, this is what would pop up when you type in schools.healthiergeneration.org. You can enter your school's name or zip code. You, as a partner, would want to register and create your own login information. You would enter your email address and put, yes, that you are a new member. Then you would click Create My Account. The Alliance would then send you an email to confirm this, to where then you would be able to log in. So this is how you register, create your account. I'm going to log in as Jamie so that I can show you the system itself. So once you're a registered user and you are connected to a school, when you first log in for your first time, it's going to ask you to connect yourself with a school. So you would search for schools. Another tip with that, all schools in Kentucky are in their system, so you should be able to find it. But know that the less information you put trying to find a school or district, the better. We found that if you were to, for example, type in Woodford County and search, you might not find anything because in their system it's Woodford CO, so county was abbreviated, and that's why it didn't pop up, so it's kind of picky. So the best bet would just to be put Woodford and then search. So just know that when you're trying to find a school or district that you may have a little bit of trouble. So this platform and website, as Jamie mentioned, basically changed 3 weeks ago. When you log in here, you'll see your dashboard. At the top is just a menu of log out, help, your account, and the schools that you're connected to. Down in the body, you're going to see modules. As he mentioned, these are now connected to the modules of the School Health Index. Know that the Alliance is still an obesity prevention program, so their focus is still physical activity, nutrition, and staff wellness, and the areas related to that. But they do contain, they do include all components and modules from the School Health Index, so schools are welcome to assess themselves in all areas, not just physical activity, nutrition, and staff wellness. But before we look quickly into that, I want to show you on this dashboard process up here, this bar, which I don't know why I can't scroll over very well, but it's school and team details. Now we're connected to a demo account, which is what you're going to see right here, that's already been set up. This process, this website is very easy, very user-friendly, so don't worry when you're starting out and helping the schools start this program. But basically, I'm just going to give you an overview of just a few things within the website. It'll go into a lot more detail once you're able to work with the schools to do their inventory or assessment and things like that. But this is the school activity. This is, have they done their assessment, and are they working on an action plan? We'll talk about that in a minute. Here's their team member list. So this is where you would enter all your committee members. This is where the school would include everyone. You can invite team members, so it actually would generate, if I was to click on this, I would enter someone's first name, last name, email, member type. So this most likely is done by a school champion at the school level that you would work with. Membership type, there are technically two, but within this demo account, it's a little bit different. But you would either become a team member or a fan. The difference between the two is a team member can make changes to the assessments, to the action plans, and they have all access. If they were selected to be a fan, basically they could just look at it all, but are not able to make changes. So the reason for that is that oftentimes, a health or PE teacher might be their champion in working on this, or maybe a Family Resource Youth Service Center coordinator, and they have parents involved in their committee, but they don't want them to be able to make changes, but they want them to be able to look at the information, so they would make them a fan. So that's just one example. I'm going to go back to the other screen. But basically that sends the invitations for them once you enter the email address, so that then that person can set up their account. If you look here, you can always remove someone. If there's staff turnover, something like that, you can remove them from your team member list. There is a option for district team members. This is a key part because there are many questions in the assessment that relate to the school meal pattern. So you want the food service director at the district level to be involved in this process. By giving them access, they would answer the assessment questions related to the school meal pattern, and they only have to do it once, and it populates for all schools. Most of this is all done at the school level individually, but that information is always consistent throughout the district, so they only have to enter that information once, and it populates it for the schools, and they don't have to worry about going and finding that information and trying to figure it out. So that's why a key person from the district that would most likely be involved. The district health coordinator may be involved. It can vary, but a food service director is definitely important. And then sent invitations. So someone sent an invitation, but they haven't responded yet. So you can either revoke or you can resend if they haven't responded. Maybe, again, their staff turnover, they're not interested, or maybe they just deleted the email, it went to their spam box, who knows. So those are some easy tools that you can use when helping to get your team or committee signed up to have access to this. Okay. Let me
Show them the multiple schools too, because many of them may have multiple schools.
Okay.
So
up here at the top, when you come into your dashboard, you're going to see over in the top right your school. If you were to click on this, you can see that you can be linked to multiple schools. So if you are going to do this program and help schools at the elementary, middle, and high school level within the district, you can have access to all schools and where they're at in the process. So it'll keep track of it over here for you. You can see from that drop down, you can add a school or you can add a district. and they should all be in this system. I'm going to stay on this dashboard for just a minute, and then we're going to go to the tools and resources. Like I said, I'm not going to go into a whole lot of detail with this because it really is, once you get in there, it's pretty easy to use, and you've got to get your committee on board and get with the schools to do this. So again, these modules are reflective of the School Health Index. So I'm going to go into Module 3 here, and so you can see what one looks like. These are the assessment questions that you would answer. As you can see here, over on the left-hand side, these are kind of a light blue. That means that someone has gone into the demo account and completed them and assessed them. If I was to click on, let's see here, the first one. This is what the question would actually look like, and this is the assessment part. Actually, I take that back. Sorry, I'm going to go back out of here into one that is not completed yet. Okay. Actually, let's switch schools here. Let's go to Jamie's kids' school. All right, this will be a lot better. Go back into that physical education, physical activity. This is Module 3. These are you'll see for the Alliance, for the Healthy Schools program, there are required items. These are their framework that they expect schools to answer. As I mentioned before, the School Health Index goes above and beyond only physical activity, nutrition, and staff wellness. Where it says optional items are those School Health Index items that go above and beyond those issues that are optional for schools to complete for the Healthy Schools program. So it's up to them if they want to look at these or not, but that's what is meant by optional versus the required items. So let's go into the first one here, 150 minutes of physical education per week, and since this is at an elementary level, it says, do all students in each grade receive PE for at least 150 minutes per week throughout the school year? This is where you or the school, the committee, would answer this based on what's going on. So let's say that, and it breaks it down for you. Let's say we choose that 90 minutes for all students in each grade throughout the school year. So I'm going to click that one. And it's going to ask me if I want to put this in an action plan. Because we did not select yes to this question, which means that this school is not fulfilling that item, it's going to see if we want to add it to our action plan. Yes or no, you can decide now, but you can also put it back in later. Once you go through this process, you'll learn a little bit more about the assessment and the action plan. But know that as you answer all these questions, if this is an item that there is no way that we could increase the amount of minutes, let's say, for PE, we would not want to add it to our action plan. So we would just say save and next. Or maybe it is, if it is something you can address, then yes, you can add it to your action plan. So one of the beauties of the Healthy Schools program being online and the work that they've done with it is after you've done your assessment, it will generate an action plan for you. Whereas the School Health Index, if you've ever worked with that, you have to write out your own action plan, come up with your own steps and resources and things like that. This program will do that for you once you've completed the assessments. So I'm going to go back to the dashboard. So that's getting into the system, looking at getting your committee signed up, beginning the assessment pieces with these modules. And then down here on the left-hand side is the other item that we wanted to show you. So once you have a login and are able to get into the system, whether you have connected with the school, whether you've done any of the assessment, have an action plan, it does not matter. You have access to their tools and resources. This is a great database for information. So looking down here, something we definitely want to point out is looking under these wellness categories. These are the categories that the Healthy Schools program focuses on. Remember I mentioned physical activity, nutrition, and wellness. If you look on this, click on this bullet point here, wellness councils and policies. So you're probably going to be working with the schools and districts on this most likely. They have resources for you in addition to what's on our KDE website. In the quick links here, there is a school wellness council toolkit that we feel is very, very beneficial to helping you and helping the schools in this process, an introduction, starting it, who to involve, how to involve them, group norms, just simple things like that on when you're first getting a committee together, or maybe you have one in place, but it needs a little bit more direction. So that is one resource that we want to make you aware of. I click back out of here. As Jamie walked us through earlier, there are physical activity resources. Let's see here. Let's see if I can get it. Into the resource database is a good tool. You can search down here on the left-hand side by topic. So looking at, let's say, healthy eating, and we're looking at school celebrations. Maybe we decided to put that in our policy, and we want to make sure that we have some alternatives and things like that to give as examples. There's lots of resources already here for you to pull from letters to social media pictures to PowerPoint presentations. There's a abundance of and variety of resources here for you. Are there any questions yet right now for the Healthy Schools program? Again, it's one of those things that you're much better off just going in and playing with it, but you definitely want to partner with your schools to get them started with this resource also. Let me log out. Okay, I'm going to log out. If you come to questions later, don't hesitate to ask. They also have this help at the top. There's actually people in place to help you with a toll-free number and a email address that you can email questions to, and they are very helpful. They've helped us many times, especially with the system changing, so know that the help button there is for you also. One more thing I will say about the Healthy Schools program. As Jamie mentioned, we don't want schools to think that this is one more thing for them to do. So what we've done in the past is we created an alignment document that shows the items that are in the Healthy Schools program and how they directly relate to characteristics within the Practical Living Career Studies program review the schools are working on. With this update and merger of the Healthy Schools program with the School Health Index, we haven't been able to update that document yet, but I've made a note that as soon as we get that alignment document completed and updated, that we will be sure and send it to you, because it's a really good buy-in tool to use with schools when trying to get them signed onto this program if this is the direction that you go. Let's see. Oh, I went back. Let's see. Did you put a poll in?
And just another thing to add to further that before we go to this next interactive poll, if you worked with schools before previously using the School Health Index, as a state, we had to strategically start looking at how to inform policymakers, how to inform the LRC report that's due every year here in Frankfurt. And what we found is while the School Health Index was a great tool, it wasn't very user-friendly and it didn't produce data for us. And so that's the reason a few years ago we started moving towards pushing schools to use the Healthy Schools program. Now that those forces have aligned with the criteria and the processes, it's a win-win for everybody involved, whether you're at the national level, the state level, or the school level. Data-driven decisions are crucial, and so this tool not only helps with accountability, but also helps to inform districts and site-based councils about what's going on in school environments. And so it really is a consistent, and that's what we look for when we look at sustainability. We look for a win-win-win, and we really believe that what we've done and created is certainly helping to forge that conversation forward. So we do have another interactive poll, and then we're going to do movement, and then we've got two other things that we're going to close out with. The next thing we're going to segue into is Humana Vitality. We do know that open enrollment is coming up and that our state insurance is switching from Humana to Anthem. That's for the healthcare coverage. There is no change to the staff wellness promotion prevention program. That will continue to be Humana Vitality. So those are separate bid processes. In fact, Humana Vitality is a separate company in and of itself. So the things that we've done and we'll share with you around Humana Vitality will continue to be a part of what we're doing, will continue to be a part of the state insurance plan through the Kentucky Employee Health Program. So just know, I want to be clear on that there are no changes to the usage and enrollment. The Living Well Promise will continue to go forward, I'm told. And in fact, it made up some of the things that were asked. Last year, just the health assessment was required. This next year, I've heard that there may be some plans that actually require the biometric screening. So many of you guys have already had health departments have been involved in that. So we may have even greater usage going to biometric screenings and the other things offered through Humana Vitality. So here's your question. In what ways has your health department engaged and or promoted with Humana Vitality? So again, you're going to text in the body 717-217, that goes in the body, and then the two-part is 37607. So tell us what you've had going on out there in your health departments. Have you been doing the biometric screenings? I know some health departments have put banners up to promote the health promise and different things. So let's just take a few minutes, and then we'll go into showing you some of the things that we've done and partnered with Humana Vitality. As we're doing this, I encourage everyone to just go ahead and take a stretch as we're watching some of these come in and some people reporting. So let's just go ahead and stand up and stretch out a little bit. I'll let you do that on your own. We want to make sure we're in compliance with our wellness policy, so it has been 30 minutes.
Excuse me, but we're not getting, what do we need to use with this out of text?
So for your text message, in the two-part, where you would type a number or select someone's name, you do 37607, so that's the number you enter, so that's the two-part. The first part of your body or message, you enter that code, and then you'll see that that's what you're reading here. So the code doesn't show up when it comes across, but it allows it to send it straight to this virtual poll. So the two-part, 37607.
Okay, thank you.
You're
Thank
welcome.
you.
No. I can switch it to a word. One thing that we will do with these interactive polls, when we do a follow-up email to you, we'll make sure that we share some of these responses that we collected. I do apologize. This is the first time I used the scrolling version of this, and I didn't realize it scrolled so slowly. But I would go in and switch that, but given our time, I want to go ahead and keep moving. So it does look like many of you have done some of the screenings, have done some of the promotions, and some of you actually have even worked with some of your school districts on this. So it has been a great program that's been out for the last 2-3 years now. Last year was really the big driver year because with the state last open enrollment period, we had the Living Well Promise, and so that simply required people to complete a health assessment by May 1st. Big picture, what do we know about Humana Vitality with state employees? Which includes, your health departments, your school district employees, and all the above. We know that 80% of all state employees selected one of the Living Well Promise plans last year. We also know that of those 80% of all state employees, that 95% of those completed the promise by May 1st to do the health assessment. We will know here in the coming weeks or into the 1st of October what that looks like for the new year. As far as how they're going to continue to drive enrollment around this prevention program. So we want to share with you some things, and here's why we wanted to focus on vitality for just a minute. When we ask schools to do something, you can come in as a champion. You can find a PE champion or a health champion or a school nurse that's a champion, but if you got 3 or 4 champions, but yet you're working in a building of 30 or 40 people, sometimes change is hard to do. And so one of the most synergistic effects that we have seen is offering engaging staff, giving them something for free. So Humana Vitality is a way that we bring awareness to that, of their own personal health and wellness, and helping them to potentially become role models and being more engaged in some of the environmental changes that we're seeking to do. So some of the best examples of schools out there that have created some of the changes, from classroom parties to recess to different things, has come because they've had a complementary layer of engaging, involving staff. And so that's the reason we really see this as very crucial to that. And so we want to be very specific and share with you some of the great work and some of the new exciting things we have getting ready to come out with Humana Vitality. Just like with the Alliance for a Healthier Generation, we know that here's what the state engagement team looks like. Each of these people are assigned to 2 regions. So the Humana Vitality team, we work directly with Jayla Miller, who's the account executive for Vitality, and then she oversees this team of specialists that cover different regions of the state. There's one region 2 and 4 that's currently being interviewed for. We'd be glad to share this map with you. If you do not already know your regional Humana Vitality contact, let us know. We'd be glad to share this with you. I know that I work with Ken Robinson a lot up in the northeast side of the state. I know he's done a lot of wonderful things up in that area with both Gateway and Buffalo and some of those areas. Our summer trainings that we did with the co-ops, we made sure that we had a Humana Vitality staff person in each one of those to connect with the teachers. So they really do have hands-on of helping people, go beyond just that Living Well promise. So as we look at this, we want to take you into the website with Living Well. So the website is livingwell.ky.gov. So once again, we want to do a live look in to show you what it looks like and where these tools are. So the website again, livingwell.ky.gov. Why did it do a search?
Oh, because there's no www.
That's a harsh thing to turn on. No, it's completely different.
Living Well Promise. Scroll down. Wait, scroll down some more.
It changed.
So they've changed the website on us.
Or this is an old browser, maybe the web browser.
Menu, go up. Menu on the right, yeah.
Okay. All right, sorry, this is a little different web browser view, so I take a second to get oriented with it. All right, so livingwell.ky.gov comes up. There used to be and so depending on what web browser you're using, there may be tabs here in the middle. So I clicked on the menu button over on the right side, and one of the tabs that you will find, depending on the browser you're using apparently, is this one. That's where we wanted to focus on, Wellness Champs. So when you go into the Wellness Champs, here's a number of different things that we have worked and partnered with Humana Vitality to create to help build buy-in support for some of these other areas with engaging staff around these issues. So what you'll find down through here is we worked with Humana to do the Family Resource Youth Service Center champions. So they did a lot of trainings with those coordinators across the state about 1.5 years ago when Vitality was first rolling out. They've also created a school district champs, health department champs, and then they have some other state agency HR people champion different things. So you'll find some awesome examples in that. Since we're talking about school health, we're going to go into that one particularly for the school district champions. And what you'll find is some simple ABCs of a healthier staff. Why is it important? How does it fit in? They take some things from our language of things we were working with schools on. And that's where they created the ABC, so there's a PDF of that. The Healthier Living 101 gives examples in and out of the classroom for promoting staff wellness to your school. So as you're connecting with people, know that those are great resources there to help drive the conversation. An awesome one to look at comes out of Raceland, up in the northeast side of the state, up in Greenup County. This is one where Ken had worked with Raceland Independent School District. So if you want to see what Humana Vitality looks like as far as school district engagement, here's a best practice that they were able to capture. So you'll see conversations and comments from the superintendent and his view of why it's important and things that happen in their district. You'll see the insurance coordinator and her perspective. You'll see the total numbers. You'll see some logistical information. Then you'll see some of the other people, the health coordinator, the school nurse there in that area. And so just a great collection of information related to how this particular school district has done some amazing work with Humana Vitality and what it means to their bigger overall goals of college and career readiness. And there's some examples of some outcomes of things that happened as a result, from accessibility to the walking track. You'll see there the connection with the health department and being a partner in all this. So this is just one example of a best practice, and so what we hope is there will be many, many more of these occurring in the state of Kentucky, because we know when we focus and help schools improve staff wellness, they're also going to get better buy-in to do things with student level things that we're trying to achieve as well. So that's the best practice. We mentioned earlier the Coordinated School Health Summit. They also have a video linked here from their site for the Wellness Champions from Kara Blackman. Kara Blackman is Bardstown Independent Schools, and so she was our person that came to the Coordinated School Health Summit and shared. So her TED Talk video is posted here. They've done some wonderful things there in Bardstown Independent Schools with staff wellness and promotion, and so done some amazing partnerships with Humana Vitality to make sure that that rolls out to their staff there in Bardstown Independent. So there's some other things through there that you'll read as well, and so just know that these are things that we want to connect teachers to, connect school champions to get more people using, especially with the increased emphasis around school health environments. We're really, really excited about the work that continues to happen with Humana Vitality. So we just want to show you where those are. The other cool thing that we're excited to share with you is a brand new program that you will not find on the website yet. This program is set to launch at any day. We're waiting on the final release of the press release, the final version of that. As with all things in state government, you can always expect it to take longer than you anticipate. And so that's where we are with this new program with Humana Vitality. That program is called Students with Active Role Models. And basically, when we started looking at, like many of the things we did here today, we stood up and did the Taebo, we did the stretching, and so just some of those simple things that we want teachers to do in the classroom. we realize there's not a lot of incentive, and so there's sometimes a lot of pressure to teach, but not really engage students' brains through exercise and health outcomes. And so with this new program, our mission is to reward school teachers and staff for actively participating in physical activity in a classroom setting, or a school setting more specifically. So before, during, or after school, anything that happens, it can be a classroom teacher leading 25 kids, or it can be a staff member, a classified staff member taking a student on a walk to help him regain his mental focus. If that teacher, that staff member is a part of Vitality, engages a student in any way, shape, or form around promoting physical activity as an active role model, then there is now going to be a system in place where those people can earn Vitality points. Of course, if you've done the Vitality program before, you know there's lots of ways that we work. We get people exercise and healthy and screenings and awareness. So points become bucks. Those bucks can then buy you Amazon cards and Fitbits and iPads and different things that accumulate over time. So it is a personal incentive to get more teachers and more staff and more school level people engaged in being active role models. This is a program that we are rolling out here in Kentucky. It is very unique to Kentucky. It was created by our staff here with Coordinated School Health and our Humana Vitality team. So we're really excited about the impact it has for promoting your work and our work and getting school level implementation to really occur because of that personal incentive at the staff level. As soon as this is officially released, we'll make sure to include that in a follow-up email to you as well. Like I said, our goal for that was the middle of August when school was starting back, but we're kind of waiting in that circling mode right now, waiting for that official press release to happen. Questions on Humana Vitality? Great. All right. If you have questions, email them, text them as we do that, and be glad to help you and get more information. Exciting things happening and continues to build the support statewide. Last thing we want to touch on before we close out and do any questions, and that's another option that we have here, and it's this concept with Let's Move Active Schools. We talked about that at the beginning a little bit and mentioned it, and so we just want to show you how simple and easy this program is and how compatible it is with the things we've already covered here today. Let's Move Active Schools. How long has it been around? It's been around 2 years in February. Let's Move In Schools has been around a little longer, but 2 years ago in February, the President's Council for Fitness and Sport, the Alliance for a Healthier Generation, and AFERD, or Shape America, our National Health and PE Association, partnered to make sure that Let's Move Active Schools is a sustainable program into the future. So it is no longer directly a White House initiative. So it is positioned, because it's with our professional association, to be a program to continue well into the future beyond the current presidential administration. It has been a great program to bring around awareness of what's going on. So as you look at what Let's Move Active Schools is, earlier Stephanie, and when talking about program review, she referenced the Comprehensive School Physical Activity, or what we call CSPAP. And so what is CSPAP or CSPAP? It's looking at school environments beyond PE. We can pound a drum all we want to on PE and say kids need daily PE, kids need daily PE, but the reality of that message is most schools, that's not possible. And so as we think about what 21st century physical education looks like, that's what we get with comprehensive approach, and that's what Let's Move Active Schools is promoting. If we get daily PE, that may mean that we have 95 kids in the gym class. So you get quantity but not quality. So with Let's Move Active Schools and comprehensive approach, it's saying PE is the cornerstone. Kids need that, students need that. The skills, the knowledge they learn there, they're not going to learn anywhere else. That's vital for how successful they're going to be in life and changing many of the outcomes that we're looking at now with chronic disease and obesity and other issues. PE has to be at the cornerstone, and we have to maximize PE opportunities. But at the same time, we're also realistic to know that we have to also work with schools to create other opportunities. Physical activity during the school day, before and after school, staff engagement we've already mentioned, family community engagement. So comprehensive physical activity, or this social marketing of Let's Move Active Schools, is simply providing a platform to promote this notion around 60 minutes a day, creating opportunities for kids to be active 60 minutes a day. So I told you I wasn't going to throw another program on you, so I'm going to quickly go to it and show you what that looks like. Here's the cool thing. I told you the Alliance for a Healthier Generation is a managing partner. So for schools, you don't have to create another login. It's a different website portal. You go to letsmoveschools.org. But what you're going to find is the same thing that Stephanie entered earlier when she logged into the Healthy Schools program is my exact same login and password for this process. So as I log in, you're going to find a very, very similar process. You see the dashboard that Stephanie showed you in the Healthy Schools program. You see the same kind of steps. The words are a little different. You'll see the same access up here at the top. There's the developmental temporary access of that school that we were looking at earlier. There's the other two schools that were on my dashboard with the Healthy Schools program. Here's the only difference. With Let's Move Active Schools, you're only looking at PE and PA questions. So from the Healthy Schools program, you may be looking at school meals, you may be looking at nutrition education, you may be looking at a lot of different areas. In Let's Move Active Schools, it's only focused on PE and PA. The good news about this inventory is if you've already completed your assessment, you're over in the Healthy Schools program, you don't have to do another assessment here. It'll transfer in. If you start here and later decide to go more broad and you want to work in health ed or nutrition or school meals, then what you do here in Let's Move Active Schools will then transfer to Healthy Schools program. So once again, time crunch people working in schools, 30 minutes of planning, it's a simpler process. And so these are new alignments that have just happened over the last few months. And so this just like Healthy Schools program is a very new inventory. It just changed 3 weeks ago because it is that aligned and compatible with the Healthy Schools program because that's who's powering this inventory and action plan. The one key advantage that you will see, and I want to highlight down here, everything else is the same except for this little piece down here. This is the big one because that's where some money is available at. And so with Let's Move Active Schools, there are a number of national partners coming to the table and offering grants and prioritization of grants through the Let's Move Active Schools framework. So once you click on the grant tab there you'll see there's a training and money available through the Presidential Youth Fitness. You'll see money through Fuel Up to Play 60. And then you'll see it through MOX, which is a before school program as well. As new opportunities become available, then there are more grants available and opportunities to do that. So it is an amazing partnership that's occurring at the national level with Let's Move Active Schools. We continue to promote that and recognize schools for being engaged. Again, it aligns with the program review expectations. So as we look at that across the spectrum, we've talked about WellSat, we've talked about the Healthy Schools program, and we've talked about Let's Move Active Schools. What we want to do is show you that we want to help you meet schools where they're at. We're not trying to force a school into any particular process because everybody's in a different starting gate. But these are the different options. If I have a brand new school that's done absolutely nothing before with a committee, then I would start with Let's Move Active Schools. It's a simpler process. It's a smaller evaluation assessment. It's an easy place to start a committee and start the process and only look at PE and PA. If you go into a school and say, hey, we've had a committee going for 2 or 3 years and we've done this and that, you may want to start with Healthy Schools program because they probably already have addressed some of these things with Let's Move Active Schools. Important to know what tools are out there, but also realize how interconnected each of the different assessments are for helping schools to move forward. We'll be glad to help you and support you in any way as we move forward with what best approach may be with each of these. And so that's the reason we wanted to cut this down to a 3-hour day and then kind of show you a brief highlight of each of these. Like I said, this will be archived and available for you, but know that we're there for you to help support you and next steps as you start looking and working more directly with your schools and districts. The other thing with this real quickly as I close out on Let's Move Active Schools, is around this notion of a physical activity leader. We've hosted 3 of these trainings around the nation. Any school district can do these trainings for free. Nike is sponsoring these trainings, so we have a number of trainers across the nation that are working with school districts as they continue to drive enrollment with Let's Move Active Schools, but also know that there's a free professional development event. So we'll be looking at how to sponsor more of these moving forward. And so it really looks at the advocacy skills, it looks at the leadership skills around being a champion for this notion of comprehensive physical activity that's embedded within the Let's Move Active Schools process. So again, Kentucky's made tremendous strides in these areas. If you are in the OVEC region, which is up surrounding Louisville, Shelby County, and Oldham County in that area, or down in the KVEC region, the Kentucky Valley and Hazard, southeast Kentucky, we have leaders from both of those co-ops that will be going to a Let's Move Active Schools event at the White House here in 2 weeks. So we continue to be on the national radar for some of this work with Let's Move Active Schools. So know that Jeff Hawkins from KVEC and Sarah Monarch from OVEC are 2 education leaders that are working with numerous superintendents around the state that are going to be working with an education roundtable with the White House, with President's Council moving forward. So great opportunities and great awareness we continue to bring and build back to this state. So in closing, select a district, 3 schools, elementary, middle, high. Identify a contact person. We've showed you the sheets and how to kind of draft out the committees, but finding you who that best contact champion person is at the school level, finding out where that school's at. And then, as I just said, meet the school where they're at, meet the district where they're at. If they're ready to take on the district assessment and want to do WellSat, we're here to support you and help you move forward doing that. The end of this month in September and the first Friday in October, we will be doing a training very, very similar to this with food service directors in the state. So if the food service director made your list a while ago, know that we're going to be having a very similar conversations on these alignments with all food service directors coming up at the end of this month. So that's a conversation that you can build from moving forward. If you're working at the school level, the Healthy Schools program provides a lot of that impact. We will get that updated on the alignment tool that Stephanie mentioned. Get that out to you. That's tremendous. If you come in and say, hey, let's make schools a healthier, happier place, you may find resistance. But you come in and say, hey, program reviews on your plate. There's a lot of things that it's asking you to do. I know a way we can help work together to strategize one tool, one inventory that's going to help us with multiple things in that state accountability. That's a lot of buy-in. That's really helped to change the conversation, as we've said. And then if you got a school that's just fresh off the start and in their infancy with coordinated school health and wellness, Let's Move Back to Schools is a very simple, quick process, and there's also some funding available. So those are the kind of overview of the different tools and assessments. And hopefully, as you look back at what we've shared with what's going on at the state level, with both the SHAPE network as well as with the Health Subcommittee, we are driving this conversation. There is as much conversations as I've ever witnessed in the state as a result of all these different efforts by multiple agencies around changing school health and staff wellness in our state. Questions out there?
I'm going to put our contact information back up too to help you out.
Couple things to be aware of that I am aware of, future dates. I do know that October the 7th, that's the closure to the Southern Obesity Summit. The Southern Obesity Summit goes from the 5th through the 7th in Louisville. They work around the 7 pillars. There are school health breakouts that we will be helping to facilitate. As I mentioned, we'll be having a health subcommittee on Sunday night. On the 7th, at the conclusion of the Obesity Summit, the Partnership for a Fit Kentucky, that Elaine Russell leads up, is going to be meeting there on site at the Louisville Downtown Marriott. There is the Southern Obesity Summit, there is an expenditure cost to that, of course, but for the partnership meeting that's meeting after that, October 7th, there is no cost for that. It is a free meeting, so if you've not got that information, shoot me an email. I'll be glad to share that with you about that event and how to register for that. And like I said, there is no cost for that. I also know that I've been having conversations, and many of you on here have been involved in the past with Kentucky Action for Healthy Kids. They also bring a lot of grants and resources. Mimi Purdue is the new state coordinator for Action for Healthy Kids. Many of you know Mimi through the PACS Now program. So she is now the state coordinator for Action for Healthy Kids. We're working to develop an action plan for Kentucky Action for Healthy Kids. One of those things is going to include a school health pre-convention, some sort of alignment with KPHA. We know that KPHA is going to be held in Owensboro this year, so Action for Healthy Kids has some funding available, so we want to work and partner with KPHA to have an event out there in Owensboro, hopefully on site. We've not had particular conversations yet with KPHA leadership, but that is one of the goals that we have of having a Action for Healthy Kids school health event in conjunction with KPHA this year. So two great things that will continue to help you build the work and hopefully have some sharing and networking going on with each of those. I'm checking my email, I'm checking my text. I don't see questions. If there's other follow-ups beyond here, please let us know. But thank you, and we're going to close this out.